Histex-Ac is a combination product used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses, such as sinusitis and bronchitis. It helps relieve stuffy nose symptoms and contains an opioid cough suppressant that reduces the urge to cough. It also contains antihistamines that relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that opioid cough suppressants should not be used by children younger than 18 years due to the risk of serious side effects, especially breathing problems. This medication does not cure colds, and cough due to a common cold often does not need to be treated with medicine. It's best to talk to your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. As always, be sure to consult with your healthcare provider before taking any medication. Before taking Histex-Ac, make sure to read the medication guide from your pharmacist and ask your doctor or pharmacist if you have any questions. If you are taking the over-the-counter product, be sure to read all directions on the product package before taking the medication, and consult your pharmacist if you have any questions. Take this medication by mouth with a full glass of water, with or without food, as directed by your doctor. The dosage is based on your medical condition and response to treatment. If using the liquid form, be sure to measure the prescribed dose carefully using a medication measuring device or spoon, and shake the bottle well before each dose if it is a suspension. If using sustained-release tablets or capsules, swallow the medication whole and do not crush, chew, or break them. Do not increase your dose or use this product more often than directed, as this can increase the risk of side effects. If you suddenly stop using this medication, you may experience withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have withdrawal symptoms. This medication has a risk for abuse and may cause addiction, especially if you have a substance use disorder. Take this medication exactly as directed to lower the risk of addiction. If the medication stops working well, talk to your doctor. If your cough does not improve after 5 days, or if your condition gets worse, or if you have a persistent headache, fever, or rash, be sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of taking Histex-Ac include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to stay hydrated while taking this medication unless directed otherwise by your doctor. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks. However, it's important to be aware of serious side effects such as interrupted breathing during sleep, mental/mood changes, ringing in the ears, shaking, trouble urinating, weakness, easy bruising/bleeding, and fast/slow/irregular heartbeat. Additionally, Histex-Ac may cause serious mental/mood changes and very serious breathing problems. This medication may also contain codeine or dihydrocodeine, which can be changed into strong opioid drugs in your body, increasing the risk of serious side effects. In rare cases, Histex-Ac can cause a very serious allergic reaction. If you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you notice any other effects not mentioned here, contact your doctor or pharmacist. This medication can be addictive and may cause breathing problems, especially when you first start taking it. It's important to take the smallest effective dose for the shortest amount of time to reduce these risks. Avoid alcohol and other drugs that can make you drowsy or affect your breathing while taking this medication. Be aware that certain other medications can interact with it and affect how it works in your body. If you experience slow or shallow breathing, severe drowsiness or dizziness, or have difficulty waking up, seek medical help right away. Keep this medication in a safe place to prevent misuse or abuse, and if someone accidentally swallows it, get medical help immediately. If you are a woman of childbearing age, talk to your doctor about the risks and benefits of using this medication. It is not recommended during pregnancy as it may increase the risk of birth defects and could harm the unborn baby, especially if used for a long time or in high doses near the expected delivery date. Babies born to mothers who use this medication for a long time may also experience severe withdrawal symptoms. If you notice any unusual symptoms in your newborn, such as excessive crying, difficulty breathing, or feeding problems, seek medical attention right away. Before taking Histex-Ac, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor or pharmacist before using this medication, especially if you have any of the following conditions: abdominal problems, adrenal gland problems, certain brain disorders, breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney problems, liver disease, mental/mood problems, seizures, stomach/intestinal problems, thyroid problems, urination problems, or a personal or family history of substance use disorder. Histex-Ac may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana while taking this medication, as they can increase these effects. Do not drive or operate machinery until you know how this medication affects you. If you have phenylketonuria or any condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this medication. This medication may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, or liver disease, be sure to talk to your doctor or pharmacist about the safe use of this product. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, slow/shallow breathing, fast heartbeat, constipation, and trouble urinating. This increased sensitivity could increase the risk of falling. If you are pregnant or think you may be pregnant, it's important to talk to your doctor about the risks and benefits of using Histex-Ac. This medication is not recommended during pregnancy as it may harm an unborn baby. Histex-Ac may pass into breast milk and could have undesirable effects on a nursing infant. Be sure to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential interactions with other medications when taking Histex-Ac. This includes other antihistamines applied to the skin, naltrexone, and samidorphan. It's essential to avoid taking MAO inhibitors during treatment with this medication, as it can cause a serious and possibly fatal drug interaction. This includes medications such as isocarboxazid, linezolid, and phenelzine. Additionally, be cautious when taking this medication with other products that can cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, and muscle relaxants. It's crucial to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Lastly, Histex-Ac may also interact with other medications, affecting how it works in your body. These may include antifungals, antidepressants, and certain antibiotics. It's important to discuss with your doctor or pharmacist about any concerns or questions you may have about taking this medication with other products. If you or someone else has taken too much Histex-Ac and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contact a poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to a provincial poison control center. Symptoms of an overdose may include confusion, cold or clammy skin, a fast, slow, or irregular heartbeat, slow or shallow breathing, seizures, or coma. If your doctor has prescribed Histex-Ac for you, it's important to follow their instructions and not share the medication with others, as doing so is against the law. If you forget to take your scheduled dose of Histex-Ac, take it as soon as you remember. However, if it is almost time for your next dose, just skip the missed one. Do not take a double dose to make up for the missed one. Take the next dose at your regular scheduled time. When it comes to storing Histex-Ac, it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it comes to disposing of Histex-Ac, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.